A lot of diseases in medicine get their names before we understand the pathophysiology, and this is true of pernicious anemia. This condition was described in the 1800s and was called pernicious anemia because it was universally deadly before we understood that it is due to a deficiency in intrinsic factor. Intrinsic factor is a protein produced by the stomach which allows you to absorb vitamin B12. We first started to understand it when it was discovered that patients that eat a lot of liver, which is high in B12, could see improvement in this condition, which otherwise was uniformly fatal. We now know that this is an autoimmune condition, so folks with pernicious anemia develop antibodies against the cells that produce intrinsic factor or against intrinsic factor itself. The way you treat it is you give high dose B12 supplementation, and that overcomes this lack of intrinsic factor. Sometimes you'll hear this called megaloblastic anemia, which it is, but in the grand scheme of categorization of the anemias, megaloblastic anemia is a more general term that means large cells, large red blood cells. And the reason they look large is because they have impaired DNA synthesis. So megaloblastic anemias include pernicious anemia, but also include anemias due to other problems with DNA synthesis, most commonly folate deficiency. Other things can cause this as well. Classically, methotrexate will cause a megaloblastic anemia. Hope that helps. Follow for more about blood.